failed. Sometimes you see patients and they ask if they need a form for their work. They tell doctor, can you give me a form that doesn't have psychiatry on it? Of course we can. That's because truly, some of you here may be supervisors. You may be employers. There is, they go and we say, oh, don't worry, you go say, no, you saw a doctor. But I do believe some of my patients, that's when their troubles will start. So everything becomes, oh, that person, that person who doesn't, we are part of the problem. Okay. In Ghana and places like Ghana, it's even worse in the sense that it's the way we see mental illness is the way the Europeans saw it 300 years ago. Because at that time, Europe was the seat of medical sciences. It took a long time for science to figure out how the mind works, how the brain gets the mind to work. And in that time, illnesses don't wait while we're trying to figure it out. So there were people with mental illnesses. They also came up with the fact that it must be witchcraft. And there were some people who were killed, because if you're a witch, that's how you get rid of. Okay. And that's how the law about suicide also came about. The law that in Ghana, we are now fighting to get off our books. Because those days, the kings believed that the citizens belonged to them body and soul. And so if you do anything to harm your body, you were committing a crime. You were property of the king. And so you were persecuted in the same way. Well, Ghana and other developing countries, we got our independence, and together with the laws that we inherited, it was in it. UK, our colonial masters, did away with this in 1960, and ours has still been in the books. And 2 weeks ago, it broke our heart. And I'm hoping that His Excellency will put in a word. It broke our heart that it was brought up in Parliament and it was resisted. As if, someone did something wrong, so you must be punished. Actually invited a special guest who I don't think was able to come. One, Mr. Bafwe, who some of you may know him, but I watched his video. He is someone who in the community, I believe he had a spinal injury. He has a video out that he attempted suicide twice, but since then, and I didn't know about this, but he does something in the community. He couldn't come today. He didn't know. I told him, if you were in Ghana, you'd probably be a felon because you'd have been in jail. So there is a lot that we can do, and together, our voices carry. The other thing is about the witchcraft. Because people feel like it's from witchcraft, the first point of call in Ghana is the prayer camp. The prayer is not the issue. We need prayers, just like I told Ellen when she said we have a pastor. So we need prayers. I mean, you need prayer that the doctor or the nurse you see will smile, will be compassionate. But no one would want to be shackled, to a tree. You've seen, many of you probably have seen the pictures of the prayer camp. And my first picture, actually, it's sorry, I'm technically illiterate, so bear with me. But the picture I wanted to show you was a lady who was rescued. They had to rescue some people from the camps because some of the shackles caused them to have wounds on their body, and that was one that I met in one of the hospitals in Cape Coast, Ankara Hospital, after her wounds had healed. Smart young lady, she would have ended up there. I'm sure that she had the opportunity, she can be whatever she wants to be. So as the statistics that you heard, it says 1 in 4 will be touched with a mental illness. So let's do the math. Look in each row, 1 in 4. And we wouldn't be surprised if they said the same thing about 1 in 4 will have high blood pressure. You say, duh, as they say, and this is what the World Health Organization, the same people that we depend on for malaria, surveillance, the HIV, we believe them. They are telling us, they've been sounding the alarm for years to say mental illness is an illness. And there is a picture there that says no health without mental health. You need all your health systems working. And the age of onset of many of the mental illnesses is age 14. Now here, that would be high school. A lot of my patients can trace when they had the symptom. Now that they know, straight to elementary school. I haven't, in here, half of the psychiatrists don't take insurance. I've always taken insurance, and I've always worked in Baltimore, so I'm working with the real people. So I hear the real thing. People are in school, they have behavioral concerns, they get suspended, nobody says go see a counselor or anybody, you get suspended, you come back, or you're expelled. Some people in 4th grade have been expelled from schools. So by the time majority of the patients I see are in their 20s and upwards, by the time that they come, they've had this illness for a long time. So it's no longer a mild illness. Just like if by the time you have high blood pressure, nothing is done, and you see the doctor 10 years later, you're at risk for other things. So I want to talk about the health, mental health. What is mental health? Mental health is that aspect of our system that allows us to make decisions that promote our growth. Mental health is not about feelings. We feel what we believe, what we think. So there is, I'm going to use, and this is something that I do every day in my office, because like I said, I want people to understand. Since I've been around for quite a while, I've realized sometimes insurance changes and then people have to move. So if I see someone, my goal, and I even tell them, not for you to come back. If you come back, good. But I even say, but I want you to walk out of my office, being able to explain it to, when you go home, be able to explain with no mumbo jumbo. Because people come and surprising, they can describe all the heart illnesses they have, the others. When it comes to mental illness, all they know is, they gave me this medicine, they gave me that medicine. So I'm inviting you to my office for the rest of the time. So that's the lady, I didn't want to show her face, but she's a smart lady, and she was rescued from being shackled. And this is not an unusual practice, I'm sure you've seen it. So, let me go back here. Okay. This is one of my colleagues in Ghana, Dr. Henny, at the World Health Organization meeting, indicating the time to act is now. I mean, it's so bad that the United Nations had tied developing countries getting some funds to making sure they meet certain goals, which has included mental health. So that tells you it's not just us saying, the scientists are talking, we're just doing what they say. Okay, so 1 in 4, almost 1 million suicides, And 90%, we didn't say 100% because sometimes people will say, what about the suicide bombers? How about this? 90% of those who attempt suicide at the time they were in the mind state of a mental illness. I especially put this here, knowing that His Excellency will be here and will put in a word. He's smiling, you can't see him. He's telling me he will put in a word. So we were brokenhearted, really. We were brokenhearted. But we see that, he wants the same thing we all want to save lives. Except what the science is saying is not that, making it a crime is what's going to stop it. No. The problem is getting people help much, much earlier. If you have hypertension, you get help earlier, you don't get, your risk of getting the complications are less. So that's what. Now, talking about the criminal aspect. So there have been many people, not many, there have been many people, I say many, yeah, in jail for it. I met this lady, I think Ellen and someone else, two of us, heard her story from her own mouth, as they say. She attempted suicide. The next day, it was her husband who turned her in, because that's what he's supposed to do. Fortunately for her, she was in the office when the police came. When she was taken to whoever the boss was, looked at her and said, you don't look like somebody who doesn't want to live. And that's how she escaped that. And she now has an NGO, a non-profit organization helping, and as we speak, she's doing her rounds in Parliament. So, there you go. So, Jason tells me that he's watched this movie, and I'm sure some of you, or some of you, or your children, your grandchildren have watched it. How many people have watched this movie? Okay, so you're doing better. I never knew about this movie till last year. I was invited to my granddaughter's 4th grade class on Career Day to talk about what I do. And the teacher said, oh, we encourage all of you to bring your instruments. Well, first problem, I do adults. Second problem, my instrument is this. My instrument is in my mouth. So I'm panicking. And who do I turn to? Is Akosua there? And she said, what's this movie? I want just enough to say, oh my goodness, this is what I've been waiting for. So I took it, and long story short, 3 classes, they got it. After that, since then, it's been leaning, the poster has been leaning on my, on my bookcase in my office. And why do I have a quote in there? That's my office. There is hardly a day that me and a patient are not standing there and we're using it. Because what it helped me do is all those scribbles I do on paper, and now we can talk about it. So, going back to how mental health, the normal mental health works. As we grow up, as a child, and I will use an example, you grow up, when you're able to label, this is fire, this is knife, this is this, the child can know those things. That's the intellectual health of us, that's the ability. However, the child doesn't know the significance of the fire, that is dangerous. That a smile, hug, awawa too, that's happiness. You, depending on your background or where you grew up culturally and your family, you begin to link certain things to 4 major themes. Those are depicted. So that's joy, that's anger, that's sadness, and that's fear. And the little miss there that they call disgust, to me, is just a little sister of anger. So we put that by the side. So we start to link certain things to these themes, and it becomes a lens. So we look at everything through that. Now, the goal of the mental health system is to help us be content with ourselves, help us adapt to, life stress, help us interact. We are social animals. You can't just be yourself. And help us reach our lives, our God-given potential using our intellectual. So the intellectual part gives us knowledge, but I'm sure some of us know people who have knowledge but no wisdom. The wisdom is what you get from the others, the mental health system, because it looks at your situation and allows the thoughts. They say we have about 60,000 thoughts a day. The thoughts just come. I'm sure when you were driving here, several thoughts were going through your mind. But if a thought comes to your mind like, let me stop by some movie house, because your goal is to come here, your brain is going to let only those that allow you to come here, those thoughts, and those thoughts that are allowed to come, depending on which theme it is. If they're angry thoughts, they have two languages. The feeling language, you feel angry, and your body then responds in the way you are used to. So one of the analogies that I had was, think about it, if you are at the airport, okay, you have your luggage. The luggage comes, you have where the review, what I call the review, where they check, the security check. The luggages have to be in order. They have to be a certain quantity at a time, and it can't be going too fast. It goes in the review, they check which are the things that need to move and which are the dangerous things. So that's how our brain works. It's as simple as that, but that's how it works. Now, okay. So I used this in Ghana and they loved it because we all use basket in Ghana. So it's missing something. Okay, all right. So the message here is not to think that emotion is about feelings. It's about thinking. We feel what we believe and we act our feelings. So you can't change your feeling unless you change your thinking. So if the other side, the thing to keep in mind is, it means that if you go to the doctor, what happens here is people go to the doctor with their physical side, your energy, your sleep, I'm not eating. Sometimes they may not ask you the other two. My message is offload all three baskets to the doctor. Doctor, I have a change, I haven't been feeling as happy as my usual. Everything is compared to your usual. Just like our body, I know my usual energy. So if it's low, I'm the first to know it. Okay, I may come here, I'm standing here, you don't know how I feel, I may be tired. So you get the point, because this is our point of reference. Your thoughts, your feeling, and the physical. And what I showed you at the airport. So let me go to when it fails, because every system fails. When it fails in two ways, in two areas. Either the thoughts or in a combination. Either the luggages, right, which are your thoughts, they're going too fast, too many going through, okay, disorderly, we all know what will happen. All the knives that they don't want might go through. And the reviewing station itself, if those four areas, the joy, those four themes that I showed, if they are not in balance, then the thoughts that are being allowed through are just one. Let's take depression. So in depression, in a state of depression, it's like the anger and the joy are muted, and all the thoughts that are being allowed to go through are the sorrow-making thoughts. I'm not good. I don't feel good. Life will not end well. And you may say, but you have money, you have a job. Yes, they do, but they can't see it. As my patient said, there was joy around me, but I couldn't feel it. Illness makes us, we can't. Okay. So we hear about some of my panel members will talk about the illnesses, but instead of learning the individual illnesses, I want you to think about two things. The thoughts, okay? So people come and say, I can't sleep, and I ask, okay, have your thoughts changed lately? Have your feeling changed lately? So these are the things that we use to determine. And what's the difference between the normal and abnormal? We get sad, we get angry, but it's proportional to the trigger. And it's not every single day going on day in, day out. In depression, it's almost every day in, day out, affect your life function, which is we work, we go to school, we interact. When it affects that and it lasts a long time, we say you have a bout. So our illnesses come in bouts. The same combination, we'll talk about it, different combinations make the illnesses. So your task is knowing that nobody reads our mind. So nobody can know if there's a change in my thought pattern. Nobody can know my feeling. You can only guess if I have tears. You may guess, but I may just have hit the lottery. What you see is not what you get. So we learn to please explore, ask questions. That's the first thing we don't do. Look at them. They're nicely. Do you think that person looks like they'll have depression the way they are? No, it's the thinking and the feeling and the physical. So we will continue. There'll be chances to talk about what your experience and what you believe and what you don't believe. I mean, people come, some of the patients come, they don't believe, and that's fine. I say, keep coming, let's talk about it. So I think my time is up, but the goal to, is my time up? Is my time up? Okay. So the goal is that at the end of this, we want to make partners of you, so that you talk in your associations, your churches, your families. Thank you.
Thank you, Dr. Kankan. That was very enlightening. And growing up in Ghana, funny enough, there was just social perception. There were two diagnoses for somebody who was mentally ill. It's either that person was on drugs or it's GPhA, So that's all that we knew about mental illness. But then there's so much we can learn about mental illness. And as I was listening to a podcast coming here, it was like, if somebody's fighting cancer, we go like, oh, this person is just so strong, this person just fought cancer, and this person, But if somebody's mentally ill, we go like, this person is weak. Why can't this person just snap out of it? And it doesn't work that way. It's the same as if somebody has a broken leg. That person is weak with the leg. The person cannot walk. That person needs to be healed first. So we should be able to see mental illness the same way as any other disease that we encounter or we know of. Right. Before we introduce our next speaker, I just want you to know that we have some really nice t-shirts in the back there. We're using that to support the cause moving forward. So it's $25 as is the minimum, but whatever you want to donate, we want everybody to go home with a t-shirt. This says what? Depression, but meaning press on, don't give up. That's the message we're trying to give. And the other one is, I'm broken, but actually I'm okay, right? Hashtag I'm worthy, right? So it's our own way of trying to spread the message, trying to bring awareness to mental health. So try as much as possible to pick one before you leave. and whatever you would like to donate to support the cause, that would be great. Sam will introduce our next speaker, so please, Sam.
Hello. I would like to introduce our next. So our next speaker is Dr. Brian Saki. Dr. Saki is a native of the DC metro area. He's an alumnus of the University of Maryland, College Park, and also of the Howard University, where he received his Doctor of Pharmacy degree. Currently, Dr. Saki serves as a psychiatric clinical pharmacy specialist at the San Antonio Veteran Affairs Hospital, as well as an adjunct assistant professor at the University of Texas in Austin, at the Austin College of Pharmacy. Additionally, Dr. Saki currently serves as the CEO of the PILS program, which is a Pharmacy Initiative Leaders program. This is a program that he founded while he was in pharmacy school, and at the moment he's transformed it into a nationwide nonprofit organization, and it's dedicated to providing premier resources for pharmacy enthusiasts in underserved communities. Dr. Saki's passion involves helping to break the barriers of mental health in our communities and increase access to care. And through his experience, he hopes to transcend the field of pharmacy and empower future practitioners to do the same. Help me while I welcome Dr. Saki to the stage. Good to have you. Dr. Saki?
I don't know if I need the mic.
Yeah,
I talk pretty loud.
Oh, okay.
Can anyone back there hear me? If so, I can use a mic. Oh, this mic?
Just one minute. Before Dr. Saki starts his presentation, I've got word that our Honorable Ambassador has another event he has to be at, so we would like to thank him for being here with us and giving us this place to actually get this going. So thank you so much, Mr. Ambassador.
Hello, everybody. Hope everyone's having a good evening. First of all, can we give another round of applause? Okay, so I'll go ahead and get started. I realize that my time is kind of short here, so I'll try to be as brief as possible. But again, my whole goal is for you guys to be able to connect with your mental health, sort of continue the message that our physician here provided to us. So I want this to be a conversation. I don't want you all to feel like I'm just talking to you. I want you guys to talk back to me as well. So I'm going to ask a lot of questions. First one, what does mental health mean to you? Yes. Someone raise their hand? Okay, I might have to start pointing out people. You can shout it out. Anyone? Yes.
Wholeness in mind.
Okay, fullness in mind?
Wholeness.
Wholeness in mind. I like that. Anyone else?
Clear thinking, calm spirit.
Okay, clear thinking and calm spirit. One more.
Balance.
Balance.
Overall wellness.
Overall wellness. I like that. Okay. So people like to describe mental health in so many different ways, right? A lot of emotions that our doctor provided to us. Many people can consider just feeling down, depressed, sad, feeling anxious as part of your mental health. But what you guys have just mentioned is important because it's not about when you are, it's not all about when you're down, it's also the happy moments. How healthy is your brain? So I want you guys to keep that in mind as I go through this presentation. Now, there are several different disorders when we talk about mental health. Post-traumatic stress disorder, anxiety, depression. It's a big kind of conglomerate of different feelings that comes together, or different emotions that comes together to form into different types of mental health disorders. We'll kind of go through a little bit of these things, but for the purpose of this presentation, again, I want you guys to just get a better idea of how mental health actually plays a role in your heart, in your life, and your overall wellness. Can I get a quick show of hands? How many people here are healthcare providers? Okay. What about non-healthcare providers? Okay. How many pharmacists? Okay, so a good portion of the room, or actually less than I thought. So I'll try not to be as technical. I'll try to be very layman's terms and make sure that we're all understanding what I'm talking about here. Okay, this isn't gonna work. Okay. While he's getting that fixed, I also want to poll the room. What has been, I guess, your role in mental health? For those who are healthcare members, what has been your role when patients come to you and want to bring up or discuss the conversation of mental health? Are you advocating? What are some things you say to some of the patients? I'll start here because I remember you say you're also a healthcare provider. I have to start calling out people.
Usually my conversation involves always recommending that they see a third party, so some type of therapist, counselor, because that's not particularly my training.
Mm-hmm.
So I try to push them to deal with a clinical expert. So.
Okay, that's good. What about when they ask about medications? What do you all kind of say about that? Make sure you get the refills. And I bring this up because I do work with a lot of individuals, other healthcare providers, who actually do not believe in psychiatry. And it's unfortunate, yes, thank you so much. It's unfortunate because these are essentially our partners. We're working together. It should be interdisciplinary, but there are some physicians who just simply do not believe that mental health is a real thing. And I had a doctor actually say that to me before and sort of question the practice that I have and determine, well, I think all they need to do is just exercise, diet, and essentially get over it. So it's really, really important that we are communicating this, not just to those who may benefit from it, but the healthcare providers who are treating you as well. Okay, I'll skip the poll question, but we're gonna go ahead and start with the patient case. Meet Ofori Neymar. He's a superstar soccer player for the Black Stars. So Ofori breaks his leg after practice one day. What are some pathways to healing? Of course, he's gonna go see the doctor right away. He's gonna get some type of procedure to help fix his broken leg. He's gonna get some medications, and some type of treatment, infusions. He's gonna do some rehab. Now, of course, this shows a sign of support. He's in a wheelchair now. His family and friends supporting him through the process of healing. And he himself, of course, is doing the job, the role he needs to do in order to get back to where he was. So now he's fine. Now let's look at Essie Kardashian. This is a 36-year-old female who just gave birth to her newborn. She has a stable job, supportive husband, and great circle of friends. Her friends have noticed she has not been the same since her newborn has arrived. She's isolating herself, no appetite, difficulty sleeping. She's constantly just feeling down and depressed. She can't concentrate. So my question is, what about when our minds are injured? Shouldn't we treat these illnesses the same? A person who has a broken leg essentially goes and seeks the doctor to fix that. And we saw what? Support from the family. We saw constant treatment from the doctors, rehabbing. That is exactly the way we should be looking at mental health. There's going to be an acute event that may trigger, for this person, it's postpartum depression. That acute event should trigger you to go seek help and get the necessary treatment by the providers and make sure you have a supporting cast that's going to help you get through this. And of course, rehab is going to take time before you get back to where you need to be. So I'll skip my background story for the purpose of time, but just a few things here. Born in Ghana, then went to DC, straight from Ghana to DC. I'm a Redskins fan, so all those who are suffering with me, I feel you. I went to the University of Maryland, where I studied biological sciences, and Howard University, where actually Dr. Rutar was my dean at the time. I went and then did my residency at the VA in Houston, and then South Texas, where I'm currently practicing as a psychopharmacologist. That's the fancy name that I like to always use. But essentially all it is just a clinical pharmacy specialist in psychiatry. Now let's go back to the topic at hand. So mental health comes in different shapes and forms. We have anxiety, depression, schizophrenia, PTSD, substance abuse, and bipolar. I'm not going to go too deep into these disorders, but just a few facts here. We used what is called the Diagnostic and Statistical Manual, 5th edition, to help us in the diagnosis. And when we look at mental health in general, it affects about 15% of the population globally. So that equates to 970 million people worldwide. Now, what do you guys think is the highest of all these different disorders worldwide? Which one do you think is the highest? Depression? Anxiety? Okay. So anxiety is the highest. It's a cheat because this is all listed as the highest and lowest. So anxiety, depression, alcohol use disorders, drug use disorders in general, bipolar, schizophrenia, and then eating disorders. When I saw this, one of the biggest surprises was PTSD. I would think that PTSD would be more prevalent, but I believe one of the problems is, of course, the diagnosis of it. It looks like a lot of different things. PTSD, for those who are not familiar, is post-traumatic stress disorder. And this, I bring this up intentionally because I serve the veterans, and it's been a big problem in the community. And you mentioned the number of suicides per day. 22 veterans die of suicide daily. A lot of that is attributed to what they have experienced and how their problems have not been mitigated. Now, when we talk about stress disorders, post-traumatic stress disorders, it's not limited to just veterans. It's also inclusive of individuals who've had a very traumatic experience, right? And so we even think about some individuals in more rougher areas in the US, gun violence, rape. You're going to be able to actually die, or you can develop PTSD because of those things if you don't get it treated or managed. Now, mental health worldwide, this gives us a nice figure of the percentages in each country and sort of where they are in regards to the amount of mental health burden. So if you kind of look, you can see that there are a lot of the darker areas, which indicates more prevalence in mental health illnesses. You can see that a lot of the developed countries have higher prevalence